As the year draws to a close, we often take time to look back at what we've accomplished. But for dentist Steve Marsh, that means we have to go back to the future. Steve is here with high-tech ways to take on teeth troubles.
Hi, Lori.
Hello. Well, and we're talking about technology. Strange thing is that as we're waiting to go on, you got a text from a patient.
Yeah, so about 15 minutes ago, I actually got a call first from a patient that said, Dr. Marsh, I broke this tooth. I know it had a root canal. Am I okay with it? So I said, why don't you send me a picture? So this is one of the pictures she sent. She sent me about 7 of them. And so that's sort of one of the things you can do today in dentistry. If somebody has a problem, after hours, they can give you a call. They can show you the picture, and then we can tell her what to do. And because it's had a root canal, in her case, she's fine till Monday, and she'll be in first thing, 7 o'clock Monday morning. We made an appointment for her.
All right, so we turn to technology, phones and everything else, it seems, time and time again in our lives, and that turns out to be true for dentistry as well, right?
Right, we have all sorts of digital things, and usually we start with digital x-rays. Today in dentistry, we have about 90% less radiation with digital x-rays. Also, it's good for the environment because we're not throwing out lead and the plastic with it. And here's one of my assistants, actually, or hygienists rather, showing a patient what's going on. So in the old days as a dentist, you looked in that little picture and you looked on a white background. Now we can actually show them, we can blow it up, we can put it on a TV screen. And what I like is it helps us educate the patient. So if we say that there's a problem or there's something we're interested in, we can actually bring you in on it and you can help us decide what's going on.
Okay, and I'm impressed what you told me about digital impressions now. That goop you had to put into your mouth is all gone.
So no one likes that goop, right? Dentists don't like it. It gets all over and it's really tough for patients. And here's what we do in our office digitally. This is a patient, I was treating her upper 6 teeth. On the left, you see the digital impression. On the right, you can actually see what the camera actually sees. So the camera takes that picture, it makes a digital impression, and then the laboratory will then get a model that's also made digitally, and that digital model is sometimes what they can construct the crown on. So they work beautifully. They fit actually as well or better than the old crowns done the old goop way that you apparently have had experience with.
So in some way you become a digital designer.
Yeah, so one of the other things we can do is we sit down with patients, and if they say, here's what I'd like to accomplish, this is a picture in our imaging room. We have a big widescreen TV, and they'll come in and say, here's what I look like. We'll take some photos, and if they say to me, here's what I don't like, and they'll do it, I can actually draw digitally on that image, and I can change the image. I say, would you like it this? Would you like this longer? Here's what I suggest here. So that before we go and do any bonding, restorative work, veneers, crowns, we're able to actually look at it with the patient as you and I are looking, look out, and that's how we're able to design their teeth before it actually happens.
That's great. It's picture perfect.
Picture perfect. We actually have this as a wax prototype.
Okay.
And the wax prototype is something we will often make for a patient before we actually do it. Let me get it angled right for you. And that's what we'll do so that you have a very predictable result when we go on and we help design it with the patient. So you're sort of co-diagnosing and co-designing.
Excellent. You got some pictures?
Yeah, and I think that's the best way to explain how things have gone digitally. Here's a patient who I just showed you his wax prototype. He had worn his teeth down. They had turned very dark. His wife brought him in. I'm not sure why it took his wife, because you can see he's also worn them down. That's his before. We did that wax pattern. Here he is on the bottom. The teeth are very worn. Before and after, that's with porcelain crowns in the back, porcelain veneers in the front. Again, we designed it digitally before. That's that arch that I just showed you, and we showed the wax prototype. Before, broken down, a lot of old silver, replaced with porcelain in the back. We can now do it all porcelain in the back, veneers in the front. Here's a patient who came to me not too long ago. That's old 2 crowns in the front. I said, what don't you like about it? She said, they dominate. I want things to look better. I want them to flow. We did a wax prototype. We designed it on a computer before and after with porcelain veneers to give her that bright white smile that she's always wanted. Again, designed digitally. This is an extreme case, and I'll probably wrap up with this. A lot of old dentistry. She speaks in a lot of groups. She's well known. She wouldn't smile for pictures. That's the old dentistry, Lori. We did that wax prototype. We designed it digitally. And if we have a second, you'll now see the result. She wanted it natural. She wanted to build in some gradations. But again, we were able to do it, get a predictable result. And today's digital dentistry has really turned things around for patients and made it more pleasant as well.
It's amazing. As Steve has shown, technology is a terrific tool that can help transform your teeth. For more help, give Steve a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next.